People associate pain with root canals because it's typically a painful condition that you have in order to need to receive the root canal. I want to make sure that we go over a lot of the myths and misconceptions that are surrounding root canals. Fortunately, if you have the diagnosis where you're considering getting a root canal done and you have to make that decision, I want to make sure that we go over a lot of the myths and misconceptions that are surrounding root canals. So the most common question I get from patients when I ask them, do you have any concerns about, getting the procedure done that you want to review? The first thing they'll always ask me is, is this going to be a painful procedure? I'll tell you that the procedure itself, getting a root canal done, is not and should not be painful at all. Patients often will associate that preoperative situation with the actual procedure itself. During the procedure, anesthetic is used just like it's used for fillings and things like that. And there's a couple different steps that they do, but as far as what you're experiencing in the root canal, it's very similar to fillings and crown preps and stuff like that. So to sum it up, it's not a painful procedure itself. However, there can be some minor discomfort afterwards, and prior to, the tooth can be very uncomfortable leading up to the procedure. But the endodontist or the general dentist that's going to be doing the treatment is going to be providing a lot of relief for you, and during the procedure itself, there should be no pain at all. And you'll always want to make sure you keep the lines of communication open with whoever's working on you. Let them know how you're feeling, because as much as we're in tune with it as best as we can be, not able to feel what the patient's feeling. So just make sure that during the procedure that you're open to letting the practitioner know what's going on and let them know about your comfort level. Now, the second most common question I get is, what is a root canal anyway? And I've heard a lot of different things from people. They'll come in and they have a lot of different, preconceived notions of what is actually going on. What a root canal is going to be is essentially a filling that's done in the root of the tooth and not just the top of the tooth where typical fillings are done. In the unfortunate situation where bacteria from the mouth or inside of a cavity can go into the internal part of the tooth, we have to address that. We don't want to leave any bacteria inside the tooth for any length of time. A root canal is basically the specialist or general dentist will go in and clean and sterilize the internal part of the tooth, and the tooth is essentially left completely intact. So as opposed to some people come in and they'll say, are you going to take the root out of my tooth? Essentially, the root of the tooth is still there. Everything's functioning as a normal tooth, but the tooth will be free of any sensation and can just be utilized as a normal tooth moving forward. So the third most common question I get is, hey, Dr. Steinweg, if I get this done, is this going to weaken my tooth or damage my tooth? And the answer to that is actually no. Although we would think going into the internal part of the tooth would be something that's damaging, it's really the situation that led up to the root canal, which is almost always a fracture in the tooth or a large filling, which has then caused there to be an infection in the tooth. That in itself is what weakens the tooth. Multiple studies have been done where they've looked at teeth that are damaged with decay and have large fillings in them, and those are also more likely to fracture or have problems than teeth that have just had plain root canals done, like just a root canal by itself done. So in itself, the root canal is not what weakens the tooth, but there's a condition of the tooth where it's broken down already, and it's more prone to having problems because of that more than anything else. However, the root canal itself is not something that's going to weaken your tooth.